us at the Center for Human Rights, Equity, and Inclusion are really so taken by the strength of your research as it relates to capacity and complexity, which we thought were really important vectors for this discussion. And so can you, maybe let's start with capacity. Can you start by telling us what you mean by capacity, particularly in the context of a pandemic, as we mentioned, or as you explained in its early manifestations, was referred to by many leaders internationally as the Chinese virus, the Chinese flu, and Kung flu. What does capacity mean in this context?
Because I think I could speak to capacity in general. Terry could also speak to issues of capacity in terms of our research and how we're interpreting it. But then I guess that I'd like to come back to you raised a point of words being used and how things were defined. That's an important factor here. But I think first the issue of capacity, meaning specifically for us that our project is attempting to recognize that the Chinese Canadian community brings both capacities and capabilities to the overall public health and disaster management process. And these strengths that the communities exhibit are, for the most part, largely untapped. In other words, there's a large resource we could learn from to do better and how we're managing this crisis. And in terms of capacity, what we're referring to is specific skills, specific resources, effective means that have been time tested for fighting and preventing outbreaks like COVID, and even specific cultural knowledge about coping that I think the Chinese Canadian community brings.
Thanks, Jack.
Absolutely. For sure, I think we really overlook the capacity in the Chinese community for one reason or another. And part of that, I would say, has a lot to do with our Western education system, perhaps like a sense of this is how it is, superiority, if you will. But, we don't tend to turn to the Chinese community, particularly when it comes to things like traditional Chinese medicine, and say, hey, what can this teach us about a pandemic? And, it always strikes me when I learn about things, we have 6,000, 5,000 odd years of recorded history. And I learn about something like, oh, there was a pandemic 3,000 years ago and they knew enough to boil all their utensils. And it just blew me away that that kind of knowledge was out there, and it's in the community, it's passed down, but we tend to ignore that. And so when the community was really quick to say, let's mask up, that got ignored. And not only did it get ignored, it got belittled in many ways. And we saw on social media, we saw patterns of that, of people going, oh, masks don't help. You're being silly or whatever. And it became this fearful atmosphere for many people. And so even though there was a lot of capacity of people wanting to do things, wanting to make masks, wanting to help each other, that attitude that they were receiving from the wider Canadian population may turn that tone very negative. And so I do want to highlight how important it is and how those types of things have an impact on disaster management, on community health, because when people may have taken smarter public health decisions, such as wearing a mask in a public place, they opted not to. And so that's the kind of stuff that I do want to point out, and how important that is, that we do listen to a lot of this knowledge that has come down. People went through SARS, and SARS helped, or mass helped rather. And you see the infection rates in places like Hong Kong, Taipei, they're quite low compared to here. And one of the things that we were looking at is, well, they were wearing masks, but yet we were still ignoring that kind of advice. So I do want to say how important it is that we don't just dismiss a lot of that knowledge because we don't want to listen, I guess, for lack of a better term.
And I think one of the situations we saw was that the Chinese Canadian community on their own, not based on any guidance at that time, because we just realized at that time there were maybe 5, 10, 15 cases in Canada. There wasn't really wide scale public health guidance on, as there is today, on hand washing, wearing masks,
Mhm.
social distancing. But we saw and verified with our interviews situations where members of the Chinese community, Chinese Canadian community, were taking early actions, which are similar to actions we all take granted as second nature during the second wave. But this
Mhm.
was taking place right at the time the COVID 19 pandemic was beginning to emerge in Canada. In other words, if all of society would have acted closer to adopting the early actions that the Chinese Canadian community has taken, perhaps our situation would not be as bad as it is today in terms of our infection rates and levels of community spread.